We both knew we were overweight, and we had done everything. We had done Weight Watchers, we had done the South Beach diet.
I did my own little Daniel Diet 101.
And I just figured, I'm just destined to be fat. That's it.
People who are morbidly obese on diet plans will lose weight. Some of them can lose weight, and a lot of patients who come back to the clinic will say, I lost 100 pounds, but I put it all back on again within 6 months.
I went into the doctor's office one time, and they kind of set me down and said, look, you're at stroke level. That was kind of a turning point.
My doctor told me, hey, you're morbidly obese, we need to look at what we can do about this. And them telling me that that's why we couldn't have kids.
These folks cannot alter their behavior just by diet alone. They need extra help. And that's what obesity surgery does for them.
We had a friend that had it and had great success. My mother had it, and she was feeling so much better. She just had like a new lease on life. We just decided if we're paying for this, we're gonna get the best, and that was MUSC and Dr. Burns. We started out going to a seminar where they give you all the facts. We talked to a dietitian, and we got evaluated by her. Then we went to a psychiatric evaluation. Then we had to go to a class on food and shopping and how to shop and how to cook.
Gastric bypass works in two ways. Firstly, there's a restrictive component to it, so we create a tiny pouch out of the stomach. So the patients can't eat very much at any one time. They have a couple of bites of food and they're immediately full. And secondly, there's a malabsorption component to it because the first part of the small intestine is bypassed.
It was very easy to recover from. I wasn't sore or anything like that. It was great. And we were treated like kings and queens at the hospital. I couldn't have asked for better care.
I lost 185 pounds total, and my wife lost 108.
It is a long-term commitment. It's not a quick fix, it's a life change. You do lose the weight quickly, but you still have to change the things that you do, how you eat, how you shop. We found out in October that we were pregnant with our first child. He was a huge blessing.
It's very common to find that patients have gotten pregnant within the first couple of years after a weight loss procedure because it increases fertility.
I love being a dad. It was definitely life-changing.
I would definitely do it again any day of the week.
They come to us and they thank us for what we've done for them, but in fact they've really done it for themselves. We've just helped them along the way. We've given them the tool to help them and show them how to use it. It gives the patient the opportunity to change what's possible for themselves.
You want to say to people all the time when you see overweight people in public places, you just don't know how to do it without offending them by saying, listen, hey, this changed our life, it can change yours.